Hi, Eileen Veilleux, the fam here. Welcome to another installment in our mini mental health series. In this installment, we will be going over Ganser Syndrome. Before we begin, though, please watch the full video because throughout the video there will be 3 keywords. When I get to the keywords, I will say keyword, then what that keyword is. In the comment section, along with a genuine comment about the video, put in what the 3 keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's get started. What is Ganser Syndrome? Ganser Syndrome is a rare type of condition in which a person, keyword, deliberately and consciously acts as if he or she has a physical or mental illness where they do not. People with Ganser syndrome mimic behavior that is typical of a mental illness such as schizophrenia. Ganser syndrome is sometimes called prison psychosis because it was first observed in prisoners. People with factitious disorders act this way because of an inner need to be seen as ill or injured, not to achieve a clear benefit such as financial gain. They are even willing to undergo painful or risky tests and operations in order to obtain the sympathy and special attention given to people who are truly ill. Factitious disorders are technically considered mental illnesses because they are associated with severe emotional difficulties. So what are the symptoms of this Ganser syndrome? Well, people with Ganser syndrome have, keyword, short-term episodes of odd behavior similar to that shown by people with other serious mental illnesses. The person may appear confused, make absurd statements, and report hallucinations such as the experience of seeing things that are not there or hearing voices. A classic symptom of Ganser syndrome is Vorbeirden. I will spell it out in case I said it wrong. Vorbeireden. This is when a person gives nonsense answers to simple questions. In addition, a person with this condition may report physical problems such as an inability to move a body part, called hysterical paralysis. Loss of memory, otherwise known as amnesia, of the events that occurred during an episode is also common. So what causes Ganser syndrome? Well, little is known about this unusual disorder, but it is believed to be a reaction to extreme stress. Another factor that may contribute to Ganser syndrome is a desire to avoid responsibility or an unpleasant situation. There are physical problems that may cause the symptoms of Ganser syndrome as well. These would include alcoholism, head injury, and stroke. Most people with this condition also have a personality disorder, usually antisocial personality disorders or histrionic personality disorder. Keyword, antisocial personality disorder is characterized by irresponsible and aggressive behavior that often involves a disregard for others and an inability to abide by society's rules. People with antisocial personality disorders are sometimes referred to as sociopaths or psychopaths. For people with histrionic personality disorder, their self-esteem depends on the approval of others and does not arise from true feeling of self-worth. They have an overwhelming desire to be noticed and often behave dramatically or inappropriately to get attention. So how common is Ganser syndrome? Well, Ganser syndrome is very rare. It is more common in men than in women and most often occurs in the late teens and early adult years. We're being very rare. How do they diagnose this syndrome? While diagnosing Ganser syndrome is challenging, not only because some measure of dishonesty is involved, but also because it is very rare. In addition, doctors must rule out any possible physical problems, such as stroke or head injury, as a cause of the symptoms before considering a diagnosis of Ganser syndrome. If the doctors find no reason for the symptoms, he or she may refer the person to a psychiatrist or a psychologist, mental health professionals who are specially trained to diagnose and treat mental illnesses. Psychiatrists and psychologists usually use designed interviews and assessment tools to evaluate a person for a factitious disorder. The doctor bases his or her diagnosis on the exclusion of actual physical mental illnesses and his or her observation of the patient's attitude and behavior. So how do you treat somebody that has Ganser syndrome? Well, it is difficult to predict whether and when symptoms of Ganser syndrome are likely to go away. This is partly because people with Ganser syndrome often present with fake symptoms, not just simply in response to a stressful event, but because the condition often reflects someone's limited ability to cope effectively with stresses when they occur. Supportive psychotherapy, which is a type of counseling and monitoring for safety and a return of symptoms, are the main treatments for Ganser syndrome. Medication is usually not used unless a person also suffers from depression, anxiety, or psychosis. Okay, so what's the outlook for anybody that has Ganser syndrome? Well, the outlook is the likelihood for recovery from Ganser syndrome can vary greatly depending on whether the symptoms arose suddenly in response to a stressful experience or reflect a more long-term pattern of maladaptive behavior related to an underlying personality disorder. And there is no way to prevent this. So that's what Ganser syndrome is. If you haven't seen my video on factitious disorders, I did that a while ago. Look it up in there, and it gives you an idea what factitious disorders are. Remember, before I leave, I want to leave you with these words. Always see with your heart and not your eyes, because your heart is truly the only thing that sees what counts. Your eyes only see your shell. Think of a person like a peanut. You buy a bag of peanuts, you see the peanut shell, it looks like it might be a good peanut. You don't know until you open that peanut shell. Once you open that peanut shell, then you can see if a peanut is good or rotten, but you don't know until you crack it open. Well, people are the same way. This is our outer shell. What's inside is the meat, like a peanut. You don't know what's going on with that person until you can see with your heart to see what's in there. And yes, there are people out there that will use others, unfortunately. But when you use your heart to see others, you're truly not judging them for what your eyes see, but what your heart tells you. Because you can see the inside of them, their personality. Okay? Not just how they feel, but their personality, their inner self is what counts. And that's what we should all judge people by, is by the inner self and not the outer self. Because a person can be beautiful on the outside or handsome, whether it's a male or female, okay? But they can be the most ugliest person on the inside that destroys that beauty like a cancer. Or vice versa. They may not be beautiful or handsome on the outside, but have this most beautiful personality that just shines and glows. And that's why the inner person is what matters more than this. Because it's the inner person that makes you. The inner person is what makes you beautiful or ugly. This does not make you pretty or ugly. It's what's in here that makes you that way. So if we can learn to see with our hearts and not our eyes, then we can see the true person inside. And this world will be a better place. So remember, I love each and every one of you for who you are. I don't care if you have a mental disability or physical disability or you don't have any at all. We were put here for a reason, so each and every one of us matter. We're a human being. We're a human life. We have a heart. We have eyes. We have feelings. We have emotions. Anything and anyone alive matters. And remember, most of all, if you are suffering from anything and you haven't seen anybody, please seek medical attention. But, if you don't have anything and you're just having a bad day, please feel free to reach out to me. You can reach out to me through Facebook, on Messenger, Twitter through DMs, Instagram through DMs. Make a comment on my video and say, hey, I need to talk. I will do my best to reach out to you. I will go on your page, comment. I will try to find a way to get in touch with you. I will look you up on Twitter. I will look you up on Instagram. I will reach out to you. And for those that do not know, I do have a mental health group on Facebook. You're welcome to join. Right now, I just post my videos up there, but I would like the group to be more active. Once I get more people in there, we'll do games. We are going to be doing card games here on YouTube where there will be different prizes. The card games are going to be once a month. And you will have prizes anywhere from maybe essential oil DIY kit to regular essential oils to an adult coloring book with colored pencils or markers for stress relief. There's going to be a number of different things that I'm going to do. I want people to be interactive because mental health does matter. Okay? And there is such a stigma about mental health that we need to break it. And the best way to break it is through educating people and getting an understanding on it. Once you understand different mental illnesses, that stigma begins to break down and it helps you to understand other people that you would have normally thought maybe, well, this person's, a little awkward or whatever. You can start looking at their behavior as, well, maybe they have this. I'm not saying for everybody that when they act up, that they have a mental illness. That's not what I'm saying. Okay? But people tend to judge other people by what they see and how they see on the outside, how they act, without digging deep into the problem on what it is. So this is all I'm asking. Before you judge somebody, think, could there be a mental illness involved? What's going on with this person's life? We shouldn't be judging anybody for any reason because we're no better. None of us on this earth are perfect. No one is. We may be better than them in some areas, and they may be better than us in others. We should not judge. The only one that has the right to judge is somebody that is absolutely perfect. And the only one I know that's absolutely perfect is God. So, don't judge people by what you hear from others, or what you see with your eyes. If you see them acting out, don't post it all over Facebook or YouTube or anything like that. They say or do something, call them aside, whether it's through Messenger or Instagram or whatever. Talk to them personally. Don't blast it all over the place, because all you're going to do is make matters worse. All right? So remember, I love each and every one of you for who you are. So until I see you each again, bye.